That frustrating moment when conversations blur into noise. The TV volume others call painfully loud. Hearing loss affects 466 million people worldwide, yet many wait 7+ years to seek help. But what's really damaging your hearing? Can you protect it? And what revolutionary solutions restore sound today? Let's amplify the truth about hearing health. Hearing loss isn't just getting older. It's specific damage to your auditory system. Sensorineural, most common, noise-induced. Hair cells in cochlea die from concerts and headphones. Age-related, gradual hair cell decline, and medical conditions like Meniere's disease, viruses, autoimmune conditions. Conductive hearing loss includes earwax blockage, eardrum perforation, and abnormal bone growth called otosclerosis. Hidden contributors. Diabetes doubles your risk, smoking restricts blood flow to ears, and certain medications like aspirin can be ototoxic. While some causes are unavoidable, these 5 strategies preserve hearing. Smart noise management. Follow the 60-60th rule, 60% volume for 60 minutes or less. Use earplugs at events over 85 decibels like concerts and construction sites. Maintain cardiovascular health through regular exercise and controlling blood pressure and diabetes. Just 15 minutes at a rock concert can cause permanent damage. Modern solutions go far beyond making things louder. They restore auditory clarity. Digital hearing aids use AI-enhanced sound processing, while personal sound amplification products help mild cases. Cochlear implants treat severe sensorineural loss, while bone-anchored systems help conductive loss. Cutting-edge innovations include regenerative drug therapies, gene therapy, and laser-assisted hearing aids. Hearing loss isolates, but today's technology reconnects. If you're missing conversations or avoiding social events, get tested. Modern solutions are nearly invisible and life-changing. Subscribe for more sensory health insights. Has hearing tech helped you? Share your story. Free hearing test locator in description.